Sam, you wrote a story today that explains that even though these trials have actually shown the vaccines prevented COVID symptoms in people, one thing that we don't yet know, which was really, really surprising to me, is how they actually prevent the spread of COVID from one person to another. So in other words, even if you don't have the symptoms and you don't actually, the vaccine is preventing that, there's a chance that you could still spread it to somebody else even after taking the vaccine. Take us through what's going on there and why this is so important.
Yes, absolutely. So, it's perfectly fine to get a really good vaccine that reduces your COVID disease from something that had the possibility of putting you into a hospital or, God forbid, kill you, to something that is not much more than the common cold. But if you then think about the fact that if the vaccine isn't capable of completely stopping you shedding virus or transmitting it to somebody else, like you see in asymptomatic cases, then you've got a problem in that if the take-up of a vaccine is only like 30% or 40% within a community, then you still have the disease that's being passed along. And then on top of that, you've got the situation that if the virus continues to replicate and move between people, you have a risk that it has an opportunity still to mutate and potentially, and we don't know whether that can happen or not, potentially evade your vaccine and your immune system.
Yeah, I mean, and you have to think about the fact that not everybody will be able to take the vaccine because it hasn't been tested in everybody. So the more people that get vaccinated is certainly the more important when it comes to stopping the spread. Bloomberg Intelligence's Sam Fazeli in France. Thanks so much for your time. It's good to see you this afternoon.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.